How did you come across choosing this as a career, something that you wanted to do?
Therapy is not just being super, super depressed or very, very anxious or having schizophrenia or things like that, right? Therapy is just going in to talk to an objective third party who's not going to judge you.
First is, how do you find a therapist? And second is, how do you know that this is working?
I think finding a therapist is not that dissimilar from finding a partner, right? You need a therapist? Why? You're so strong. You're so this. You're so successful. You know what? Even therapists go for therapy. And
I was diagnosed with depression. It was so bad that I could never gain the courage to, because I was fully getting out of bed.
because mental health doesn't discriminate. It doesn't give a shit whether you're rich or successful or poor or illiterate or literate. That's not it. It has nothing to do with that. A lot of people use technical terminology like depression and OCD and things very easy. Oh my God, I'm so OCD. No, you just like having an organized workspace or organized home.
Hello everyone. Welcome to another episode of Second Opinion to Talk to UV, Stories Beyond Stethoscope. A podcast where we delve into the lives, the challenges, the wins, the losses of anything and everything around the medical community. Today, we have another interesting guest around us. Someone who's a clinical psychologist who has a huge body of work spanning over around 20-25 years. She specializes in, of course, issues around mental health, but she's also done a lot of work with sexual abuse, child abuse, human trafficking, female genital mutilation, and a lot of other things. An interesting conversation that we are looking forward to. It's a pleasure to have Ame Patel. Welcome, Ame.
Thank you, Yuvraj. Thanks for having me.
When we were deciding a list of guests for the podcast, it was, of course, we were kind of going around areas of interest in medicine that we want to touch. And it was a no-brainer that, mental health issues was something that you wanted to kind of talk about and we wanted to shed some light on. And then there's always this psychiatrist and a psychologist.
Yeah.
So, I'm not shying away from the fact that I work with you. And so I thought it was like a no-brainer. So thank you for coming here. So my first, introduction for you and the question here would be that why? My first question is, and especially 25 years back, like today I think it's all there. We know a lot about mental health. How did you come across choosing this as a career, something that you wanted to do?
Yeah, so I'm happy to talk about that. I just want to start by saying I'm so glad that you're putting mental health on the platform in addition to all the medical services, because I think it's past time that we highlight mental health and mental health care just as much as we highlight physical health and physical health care. So 25 years ago was a long time, but actually I was abroad. So I grew up in the US and I did all my schooling there. So there it was far more common, right? Mental health care, mental health services. There's less of a stigma around mental health there. So it wasn't as sort of surprising or challenging as it might be here, though it's changing here as well, right? So it started out because I already majored in psychology. I knew that I wanted to be in some type of practice of psychology because I just found it fascinating to understand about human behavior, to understand why we do the things we do. Why is, I think, the biggest question that I like to sort of ask. So if we understand the whys, why do we do certain things? Why do you say certain things? Why do we engage in patterns or relationships? It, I think, helps us understand ourselves better and others, right? So ruling way back 20 plus years ago, I was in undergrad and I learned about something called female genital mutilation. That led me to do some research. Then I found out there's this whole category called gender bias or bounce against it. And then I was even more shocked to understand that in our own culture, there are things like honor killings and acid attacks and all of these things that are, and feticide, female feticide, before the law was enforced. Obviously we know that the ratio is so skewed because people would have feticide or engaging feticide practice. So that's when I sort of started understanding what it meant to stand up for people, what it meant to support people. And then also concurrently, I had a really good friend of mine who was sexually assaulted. And I think at the time, I was as supportive as I could be, but I really didn't know how else to help her. So then I signed up for a course on sexual assault awareness and how to help survivors. And that's really what created the pathway. So I used to do hotline calls for sexual assault survivors. They would call anonymously. We would give them support and validation. We would go to the hospital when they were having a rape kits done and intervene with the police and things like that. And then that really started me into activism and sort of my feminist identity, right? So standing up for people's rights, standing up for women's rights, because women still are considered second-class citizens, even in a place like America. And so that all happened. And then when I realized that I could do a master's and actually work with people around lots of other issues, it seemed like a upbringer there too. And so I enrolled for my master's program, and the rest is history.
So, that just highlights a very important point that how important, first of all, their job is. I think, do you feel it's not given due credit?
I know about credit, but I think it's misunderstood. I think
Also,
I think a lot of people don't understand what mental health care is. So they think, oh, no, I'm fine. I don't need mental health services. Or, oh, I'm not crazy. I don't need to go for therapy. And I think what people don't understand is that everyone has mental health, just like everyone has physical health. Right? The WHO, the World Health Organization, defines health as incorporating wellness in physical, mental, emotional wellness generally. So I think that just as much as we go to the doctor for high BP or because we had diabetes or because I have a broken bone, I would love for more people to understand that mental health is on a spectrum. Some days you have good mental health and some days you have poor mental health. And then mental health conditions and illnesses are separate too. But I think that that's what it is. I think that it's getting its due, and especially here as a culture who is so focused on what other people will think and say, as well as keeping things private and secret, it's challenging. And there's still a stigma. But I think in the last 10 years that I've been practicing, things are shifting, especially in younger generations.
because I was always struggling with this fact, and I mean, I'm ashamed to say it, but the fact is, I used to always think to a point that you would like, how does therapist or a counselor, you just want to go and talk,
Yeah.
and then you realize, of course, you have tools. It's not just talking, but then still, if you think in that sense today, I think, don't you think everyone would require a counselor?
Yeah, I think so. I mean, I might be biased, but the general statement is that if you had childhood or you come from a culture or you had some type of experience, you would benefit from therapy, because therapy is not just being super, super depressed or very, very anxious or having schizophrenia or things like that, right? Therapy is just going in to talk to an objective third party who's not going to judge you, who said to create a safe space so that you can talk about whatever it is that's bothering you. Sometimes, most times, we don't have the tools ourselves,
Okay.
right? And people see that as weakness, like, oh, I can't even manage this by myself. I can't solve this. But we're not meant to have all the solutions. We're meant to know what to ask for help. And I think that's where people say, oh, you need a therapist? Why? You're so strong. You're so this. You're so successful. You know what? Need a therapist, go for therapy. I think that the more, I guess, what is the word? I think the more we normalize it, the more people will realize that it's okay. You all benefit. We all benefit from having a space where someone pulls up a mirror and says, did you notice that you're doing this? And you go, oh, I see this. What is this about, right? So it's just that. It's not just betting, just a lot of people think, or it's not just giving advice. We're not giving advice, right?
So, but what would you say to that 60-year-old uncle or an auntie saying, we grew up 50 years back, there were no therapists around, we grew up 5. We don't know whether they grew up 5. But
As my answer, are you? Because the thing is, just because we've survived something doesn't mean we survived it well, or doesn't mean we're coping well, or it doesn't mean that it's not affecting some decisions or relationship factors or things like that, right? And that 6-year-old uncle probably has not been encouraged to talk about his feelings at all. Men specifically, the way that they ooze out in patriarchy is that they have to become toxically masculine, right? No feelings, no emotions, no crying. I'm fine. I'm the earner. I'm okay. This all happened to me, but see, I'm here. I'm fine. That's what we hear a lot. But I think sometimes people need to remember that vulnerability is grave. It's really important to say, I'm struggling, or I need something, or there's an epidemic of loneliness happening. You have so many friends, right? I have this friend and that friend, but connection is missing. And I think that can contribute to sadness and feeling anxious and feeling lonely and feeling detached.
good. So, if you had to explain today, because I know a lot of people watching,
Yeah.
tell us the gist of what is therapy and who is a therapist or a psychologist.
Yeah. So I can't speak a lot from my perspective here in India, because here there aren't as many guidelines and regulations about who can call themselves what. It's a bit nebulous, to be honest. But I don't call myself a psychologist per se because I don't have my master's in psychology. So here the option is a master's in psychology. You do your BA, then you do your master's, and then you can go for your MPhil. You can go and get certified. So that's what a therapist counts. There's clinical psychology, there's counseling psychology, industrial psychology. There's so many different types of substyles, psychology, marriage and therapy, therapy, etc. So it's really about the specialization that people choose. And what a therapist does, well, I'll tell you my job, right? So when a client comes in for the first time, what I tell them is, this is your space. Nothing goes outside of these four walls. Even when you said that you're going to tell people that you came to me, I said, you and each other, no problem. I would sing. And even if I see a client outside, I'm not going to sing, hey, because that's their personal and private and safe space. So I create a safe space, no judgment, no, oh my God, I can't believe you did that. Oh my God, why did you do that? What's wrong with you? None of that. No advice. A lot of them say, what should I do? That's what they come in. And then after first session, like, but you didn't really tell me what to do. That I think people don't understand what therapy is, right? They are used to getting advice because they talk to friends or family or whatever. My job is to ask them, what's going on? Why do you think it's happening? How can we cope better? What tools and techniques do you need? What is your support system? Help them to understand their perspective in their own way so that they can feel more empowered. See, if I'm coming to you, it can be very disempowering because if I don't have you telling me what to do, what am I going to do? I'm going to go out thinking, oh my God, when's my next therapy session? I need to message my therapist. But if I'm teaching you tools, if I'm giving you techniques, if I'm working on building self-confidence, things like that, then you feel empowered that, I can figure this out. There's some scope for hope.
Right? But that is something that, honestly speaking, when I also started therapy, the block was, and because I think sometimes you think too much also, we used to always think that, you have your own set of beliefs. You have your own set of thought process.
Right.
Your cultural background, your social affinities and everything. And then you have yours, of course, because you're relatively new and you've grown up with your culture and everything. So I think, and I've discussed this with a lot of people, that how do you kind of not have that bias, Like you might believe in something, but I might not believe in that. Or I might believe in something, it might not believe in it personally. So then professionally, how do we treat?
Experience. I think that because there's no agenda, right? My job is not to convert you into my way of believing. My job is to convince you that you deserve to believe in yourself, that you deserve to get support, and you deserve to have space where you can just be you without judgment or fear of criticism, things like that. And how do I separate it? Because this is my job. It's not who I am. So if I'm meeting a friend and we're discussing politics, I can express my opinion and she'll express hers. But this is what I do. So my job is to be present and supportive. But I'm not trying to convert. I'm not trying to push an agenda. So I might say, like, if you believe in something extremely, say, misogynistic or discriminatory, I might say, I'm curious at what led you to believe this, or what makes you think that. Tell me more about that. Because usually what we'll cover is some things happen that has led to these very extreme or reactive or discriminatory beliefs.
Correct.
Right? Yeah. And also, my job is not to show you who I am. My job is to help you see who you are.
Get it. So also, again, Kabi, because I think the best way to connect is to bring from my experience. And when I started therapy, I was introduced to therapy per se. But of course, my case was a little different, but still, because I needed it clinically also. It was not just therapy. But, I went through multiple people.
Yeah.
And so it was, I realized that, and they were about very highly recommended. I got someone who said, oh, she's the best in the country, or he's the best in the country, whatever. I think before I reached you, there were 3 with whom I spent a certain amount of time. And it didn't work for me, with all due respect. I mean, I'm not saying they were bad or something, but it didn't. So but why I'm bringing up this point is because then I realized that there's also like a jury, like you just click.
Yeah.
And so how do you find that? First is, how do you find a therapist? And second is, how do you know that this is working? Because initially, you all the time, I feel, and I've heard this from most of the people, the first 2-3 sessions, everyone's struggling, They're really thinking, is it really worth it? Should I do it more? So you can shed some light on that.
Yeah, definitely. I think that's a really good question. So I think finding a therapist is not that dissimilar from finding a partner, right? You have to find a good fit. And a lot of times people will go from therapist to therapist, the way they do with doctors or whatever else, because you have to feel comfortable, right? It's the therapist's job to establish trust. How do I establish trust? You come in the first time, I don't expect you're going to trust me. You don't know me. I'm a stranger. So after a session, 2 sessions, 3 sessions, when you realize that, okay, I'm not getting judgment, I'm not getting criticism, I'm actually getting support, I feel comfortable, I feel safe, we just gel with somebody, right? There is like a, I guess, chemistry, for lack of a better word, right? And people do go therapist shopping, and they should. You should not have to stick with the therapist just because you started there, because you are going through something and need to feel like it's a good fit. That's one thing. Secondly, we go through different things in our life. So for one phase of your life, this therapist might work, and you might do that, but then something else might happen, or certain things might come up for you, or you want to address family origin issues, not just relationship issues, or whatever it is. So they feel like, I think this has sort of lived its life. And so maybe now you find another therapist. Yeah, so definitely people shop around. And I think that when people refer someone and say, oh, and they're fantastic, that's based on their experience. And your experience might not be the same as somebody else's, and that's okay. So that doesn't mean the therapist is bad or there's something wrong with you that it didn't fit. It just means that it didn't fit.
So what's the dropout rate, if I can ask you?
Oh, is it good or should? No, I wouldn't say it's high. I think it's more about understanding that therapy is voluntary. So I have clients that come to me once and then they don't come back. And that's okay, right? My job is still to come after. If you don't come to therapy because you genuinely want to, you're not going to benefit. A lot of times people come, yeah, my wife is telling me to come, my husband is telling me to come, my parents are telling me to come, my kids are telling me to come. But if they're not really willing to put in the work, this therapy, the work is not just mine, eh? The work is the client's. And so you see me, or a client sees me for 45 minutes a week. But then it's their job for that rest of the time to try to incorporate the things that we've talked about or consider the things that might have come up. And so I think that I don't call it the dropout, we call it attrition, or just that people disengage, right? And it's not personal.
So that brings the question that how long should one wait before even thinking of changing? We have to give some time, right? So as someone, as a professional, what would you advise that, wait for, say, like how I say, if this medicine's going to work, you have to wait for a while. Like if you want your egg quality to improve as a gynecologist, wait for 2 to 3 months. You're not taking 1 week of medicine is not going to improve your egg quality. So in that case, someone's starting cat, what would you say? Actually, minimum use many sessions and then decide whether it's working or not.
Yeah, so I don't give a number. I don't, it's like a package or anything like that. But yes, it does take a few sessions to sort of get comfortable, right? Some people will be comfortable from first session, and for a few it might take a time or 2 or 3 or 4. So what I say is that this is no magic cure. Therapy works as well as you work in it, right? The work has to be yours. Also, I tell them from the beginning, there's not how you get to therapy, right? People come to therapy, they unload or they vent. And in the beginning, it's fine because I'm also trying to get to know their background, their story. And they're like, oh, I feel so much better. And so I say, that's great. But actual therapy is hard and it's tough. And I always say it will get harder before it gets easier. So if you're willing to and wanting to put yourself through that and invest in yourself enough to figure things out, the long-term game will be great. But there was a short-term pain, right? Because it's uncomfortable to talk about hard things, to talk about bad experiences, feelings.
So then how can you, how this someone who's coming with it at stage would realize that this is working,
Yeah, there's no quantitative parameters. It's not like, oh, check. But it's usually a feeling people get. Like, I feel better. I feel better that I have the space that I can talk to this person without judgment in a way that I haven't been able to talk about something else. Or, wow, they've really shown me certain things that I considered. Yeah, so I think people, it's a slow burn.
Yeah.
It's not a cure fire.
And, when I have friends also who go for therapy, I think, so this is something as a client, I'm going to talk to the community of therapists through you.
Yeah.
Sometimes I usually feel that, because you get comfortable, this is the first time you've opened up if you started opening up. And then it's 45-minute session. Sometimes you feel like,
अच्छा ये 45 minutes खत्म हो गए.
Yeah.
I think correct, and then we have to wait for 1 week.
Yeah.
And so, and most of the times, good therapists today are like, "Oh, only booked." I mean, great for you guys, of course. So how do you, like, that used to get me a lot of frustration. Yeah, okay, now, like, sometimes, like, the first therapist I was seeing, she used to give me appointments after, like, 20 days. And I'm like, I can't wait for 20 days now since you've opened up the old Pandora's box.
Yes, absolutely.
So, like, I mean, how does someone who's taking therapy kind of understand and, accept that fact?
Yeah. So I think one is that consistency is really important. So we try to make it weekly sessions as much as possible. Sometimes in the beginning, when there's a client that has a lot happening, I'll offer a double session. So it's like a good block of time, or even 2 sessions in 1 week initially, because it is hard, right? And consistency is so important in therapy because we need to follow up. We need to check in. We need to continue the process as it goes. The other thing is that it's important not to create dependence on therapists. I don't want my client to be dependent on me. My job is to make you feel like, okay, I can handle this. And there might be days where I can't handle it, and that's okay. And you can always call or whatever. But it's not like, oh my God, it's 9 o'clock and I'm going through this. My job is to help build tolerance for discomfort. A lot of people act impulsively because they can't stand being uncomfortable. No, I need a solution. I need to, so creating discomfort and tolerance for discomfort, knowing that I have tools, I need to use them. Sometimes it's easier just to pick up the phone, right? I mean, but then I'm not eating it all well. I keep doing that.
Right. Is there a time when a therapist says that they say, rather than the client, can I call to the client?
Yes, of course.
Yeah. That this is not working. I think, has that happened?
Either what the client needs is outside of my scope.
As on the
specialty, or I'm not going to waste someone's time and money if I'm not of help, right? So I will say, you know what? I think that you might be better served by this person or this person. Or it seems to be specific treatment for like eating disorder or whatever, or substance use, right? I can provide a supporting role, but I'm not an expert in addiction. I'm not an expert in eating disorders. I know about them. I've worked with a lot of clients that have both, but if I feel like it's gotten to a point where they need help outside of what I can give, it's my job and my responsibility to say, I'm sorry, I think you need more than I can provide. And that it's not personal. It's not a rejection. Also, because some people feel...
You're very right, is not it.
Yeah.
Interesting. And so a lot of people also think that, it has to go along with the psychiatrist. So first of all, let's Joseph basically, most of the time we kind of confuse between psychiatrist and a psychologist. Yeah. So please help us understand.
Yeah. So a psychiatrist is a medical doctor. Okay. As simple as that. They can prescribe medicine. They've done a medical school. They've done their PG in psychiatry and whatnot. A therapist has a master's degree, but does not prescribe medication, does not do medication management, may sometimes diagnose mental health disorders. That generally here that's not always the case. And also a psychiatrist should go to once every 15 days, once a month for medication matters, that how's your medication treating you and side effects, dosage adjustment, etc. And the therapist is somewhere where you sit very much like this and talk.
Okay. And does it always go hand in hand?
No. Yes, thank you for running. No, it doesn't. In a lot of mood disorders, like say anxiousness, depression, and things like that, the best outcome is usually with the combination treatment plan of therapy and medication. If it's at that point where symptoms are unmanageable on one's own. But no, most of my clients are just in therapy. They're not necessarily taking medication, psychotropic medication. But if I feel like it's gotten to a point where it's impairing their day-to-day functioning, their relationships, their ability to work, etc., then I will say, I think you might benefit from talking to a psychiatrist. But that also has its own stigma.
Okay.
Because most people are like, and the side effects. But the side effects, you get side effects with anything.
Correct.
Right? If you have an existing chemical system and you put in new chemicals, your body is going to protest until it adjusts. Those are the side effects, and those are not long-lasting.
So you do not always need to send someone for a psych evaluation or a psychiatrist person. But
it's really about symptomology. So if symptoms are excessive, or what happens if I'm feeling so anxious to the point where I can't sleep, I'm only thinking over and over about the same thing, my heart is racing, I'm having palpitations, etc., I can't focus on things, then even therapy is not going to be effective, isn't it? So at that point, I have to say, okay, let's manage this so that therapy can go in and actually get for you. So we can do side by side.
But then in that case, being a doctor, I would feel anyone who's going to a psychiatrist, so we'd have reached a state where medications are required, we always require therapy.
Look at that. But people are not like, no, I'm doing this, so why do I?
Yeah. But you would mean that, like objectively speaking.
Yeah, I think people would benefit, obviously, because how else are you going to? So medication treats symptoms, right?
Yeah.
So the symptom is gone,
Yeah.
but the existing problem where King Cobras is there. So if you don't process that and understand that, then the symptoms will just come right.
This was for me, and I think it's going to come as a shock to a lot of people. When I was diagnosed with depression, it was so bad that, of course, I started. I can definitely say that medicine saved me.
Yeah.
I think if not for those doctors, and if I were not taken consider what would have happened. But the point here was that I was asked to go to a therapist and a counselor by friends, but I could never gain the courage to, because I was keeping getting out of bed. And sitting and talk. I was not even talking to my parents for 5 seconds. I just didn't want to talk to anyone. And they're coming and opening up was so difficult. So I needed that inhibition and that, that peak of illness to go first or probably subside with medications so that I could come and talk to you. So, but do you think today, at least today in India, are psychiatrists open enough to actually recommend everyone therapy?
Oh, I think a lot of them are. In my limited experience here, I would say yes. I think so. Because they also understand that medication is not enough, right? And also, most people wait until symptoms are so bad that they don't have an option, right? We don't see mental health here as a preventative treatment. We always see it as an intervention. When things got so bad that now I don't have a choice, I have to go for help, right?
That's so interesting. It's a preventive bit.
It can be prevented. Mental health care can be prevented, right? And like a lot of couples treat therapy as a preventive measure because some conflicts coming up, they don't want to wait till they get to the divorce point. So there, right? Same with mental health. We just had to take patients.
This is a side point before you.
Absolutely, yeah. And I think that also I want to say that people that believe it, that you yourself experience this, because mental health doesn't discriminate. It doesn't do shit. Doesn't do shit whether you're rich or successful or poor or illiterate or literate. It doesn't. That's not it. It has nothing to do with that. This has nothing to do with you as a person. Something is going on inside that is not in your control. And a lot of people feel like, what will people think? I'm taking medicine or there's something to me, right? So many famous people are like, wow, but they have so much money. They're so successful. They have great relationships. But that is not a criteria for poor mental health. Or it doesn't save you, right? It's not balance.
So for the audience, someone who's considering, thinking, but kind of is locked and somewhere is still hesitant to go to a therapist, what would you want to tell them? They reached a point where they know they need it, but they're somewhere, hesitant, scared. Would you like to give them a message?
What I would say is, it's okay. You're not alone, and there's nothing wrong with asking for help. There's nothing wrong with acknowledging that things are not okay. I think that's the first step. Just acknowledging you're not okay. A lot of people have such a hard time expressing any type of vulnerability. And we see it as a weakness, right? Like, well, I can't take care of this or I can't manage these. What does that say about me? But I would say that there is space. There are people that are trained, that want to listen, that want to help, and that we're not alone. I think mental health, when we're not in good mental health, when we're going through something, it feels so isolated because it feels like no one can imagine that with you. And it's true. No one, what's in your life or what's in your heart and your body, no one else can get. But to know that you're not alone and to know that there's help.
Correct.
Yeah. And that they're worth it. They're worth getting the help for. You don't have to wait till it gets so bad.
Yeah, but you would. In our country also, most of the times, I think we touched it a little bit. It's always like, but tumko kya suggestion niche? You want to vent out, come to. Like, I'm doing that for you. And in a good way also, I think most people don't realize, but they're saying it in good faith that, you come, talk to me.
Yeah. Even as a friend.
As a friend.
Yes.
Like a lot of entities I've had this, that you call me up, I'm there at 2:00. You call me, we'll talk for an hour. And I think people kind of
misunderstand the difference. That, it's not as talking to your mother. It's not like talking to your best friend or someone who's a mentor, because that's the first person you go to first. So I want you to give a message to those mentors and those friends who, in good faith, want to listen, but what do you tell them that, but you're not the right person?
Right. So first, I'll talk to a person that's struggling, right? If you're struggling, know that there are many resources for you. There might be your friends and your family and your colleagues and your mentors, anybody. That's great. You can go and talk to them. But your friends and families and mentors are emotionally invested. They cannot be unbiased. That's the thing. You can't, if we're friends and I come to you with a problem, you're going to talk to me as a friend. You're not coming to me as a professional, right? So you're going to be biased because you're emotionally invested in me. So it's important for those friends or family to recognize that you need more than what I can provide. I'm here for you, no doubt, at 2 a.m., 3 a.m., 4 a.m. But professional help is not the same as personal connection, right? We are trained for many, many years to know what to do and how to help. And most of the times, even if friends are helpful, after a while, some friends are like, yeah.
Itni baar.
Right? Because that's their stuff coming out.
This code aa gaya iska.
So, and we project our own stuff onto people all the time. Because as human beings, we're not trained to be unbiased.
Yeah.
We are subjective. That's
Sorry to interrupt you. To me now,
Yeah.
because I think that's very important. After going through whatever I went through my mental health issues, I can't be that person. Because the moment someone starts talking about it with me, I realize I cannot handle it. I have some of my best friends who tell me, don't watch this movie. This is not, you are just going to go. I'm not going to have the right impact on you.
My best friend told me not to watch Hair Diary. No, it's a great movie, of course, but whatever. But then there's this scene in a series called Arya, which was a Sushrita Say, where the daughter of the protagonist is taking a lot of pills and you're supposed to take suicide. And I never knew that scene was coming up, and I saw that scene, and it took me 3 days to come back.
Yeah.
And then, so anytime now a friend calls me up and I come to know that, oh, please have you mental health issues, or probably it's about depression or some other form. I'm like, so I think it also reflects on you, right? I think it kind of...
It maybe, we don't always have the bandwidth to be there.
Handed it also. I can mentee also.
But you shouldn't have to.
It is.
That's the thing, right? We are not meant to be everything for everyone. We cannot be. It's really important to have boundaries. To say, I love you. I'm so glad you called me and I'm sorry you're struggling. Maybe you should talk to a professional. I'll go with you. Right? It's important for us.
That?
Yeah, of course, I have a lot of clients that are exploited by friends. Oh, it's scary. It's scary to walk into a strange space. That's up to the client, but generally also I need to step out for a while because I also want them to have privacy and confidentiality. But I think it's scary, but as a friend or as a family member, it's really important for us to know this is outside of my scope. Don't pretend to be a Catholic. Everyone's like, oh, when I tell people that I'm a therapist, I can also be a therapist. Everybody helps keep up their problems, right? How many times I cannot get a nickel for every time I've heard that I would be a rich woman. Not everybody can be a therapist because not everybody is a therapist, right? I'm a therapist and because I'm self-therapist. But that's not true. It's an important professional demarcation. And there's skill and experience. In order to get licensure there, I have to work 3,000 hours under supervision, and then I can take an exam for licensing. You need to know what you're doing, right? And I think what happens is sometimes friends meet the best. Their intention is great, but end up being more damaged. Because the person who's struggling feels judged. And they will keep, especially people who are in abusive relationships, and they keep complaining about partner, which they can. And then eventually the friend's like, you're never going to leave this person. I'm not talking about this anymore. It's really damaging. Or if there's sexual assault or something else, well, what did you do? You dropped them. Yeah, right? Maybe they're well-meaning.
Yeah.
But this is a pretty shitty case.
Yep, you know what I'm
It's very hostile. So know when you can't do it. There's no ego involved here.
So we've told friends that, be friends.
Yes.
And
stay in your own lane.
Stay in your own lane. But you've given a great piece of advice,
that thing that you said, tell them I'm here for you, I understand you, I love you, let's go, I come with you, the therapist. I think that's the way you help. You don't help by becoming the therapist. But then we are now going to play a small hit.
Okay. Okay.
So we know that friends are our therapists, but still, we're going to do this thing where in 1 minute we're going to say some statements or some lines that still, anybody would not like it, but still would apply indirectly or directly to a friend and a therapist.
Put my thinking cap.
Like, I'll give you an example. Like, वो बेचारी मेरी हर बार बकबक सुनती है. So like,
But just in Hindi.
no, it's not at all. So I'll go first. Don't worry, मैं किसी को नहीं बताऊंगा.
Allegedly. She's always there for me.
मेरे पास
Oh Lord, my goodness. She's always there for me.
उससे बात करके भी 2 दिन भर
Sometimes I call, she should pick up my phone.
Nice one. High maintenance है, but worth it.
I mean, also, it's not silly. Hang on, let's see. I keep expecting her to say something mean, but then she doesn't.
That's so nice. I have to think about it. I can tell her anything.
I wonder if she's in therapy.
Oh! थोड़ी मुफ्त है, but दिल की साफ है.
Oh my goodness. Okay, now I'm drawing a blank. Sorry.
No, but I think it was done. But it was fun, amazing, nice. But coming back, friends, be friends, you're not therapists.
Correct.
And when we were talking about friends, and you touched on it a little bit, like for example, when we were doing our thing and when we were talking, sometimes, I used to also, like, I used to get inquisitive about, like you, and I probably crossed my line, start asking you questions.
Did it? I would remember you did. Okay.
But others have. So, and you've always told me, like even like we were talking about in the previous segment also that, you always keep a distance. Some would think, like I would think that probably you getting a little person would make them more, like open up more.
Yeah.
But you don't do that.
Yes.
And so why? And like, why would you never want, or why do you always refrain from talking about personal stuff? Because people feel, sometimes, people would think that, man, I'm telling her everything. She's not even ready to tell me whether she's married or divorced. So she's not even ready to tell me how many kids she has.
Yeah. I think that's a very common question. But I think the answer is what we did in the previous segment, right? Which is because I'm not your friend. I'm a therapist. And so this session is about what I do, not who I am outside of work. And so boundaries are really important. And we're taught that in our training, that when you're in the room with your client, it's about the client. I might have issues with my clients. There are some clients that I might not like, but that's my problem, right? And the client isn't coming to talk to me about my life. And it's natural that they ask questions. Of course, me is curious, right? This person knows everything about me. I don't know anything about them. I don't have pictures up in my space. I don't have, anything. But because I don't want the client to be thinking about me or my life when it's about them. They're paying me for their own stuff, right? I don't want them to waste their time or energy thinking about me or my life. It's natural to wonder. Sometimes I will give a personal anecdote as it relates, to provide an analogy or to say, yes, I've experienced this or this has happened, I can understand, but not about difficult things or traumatic things, because the last thing I want is for the client to have to comfort me. That's not their job, right? I can go to my own therapy for that when I need support. But, and in a kind way, and it's talkable, it's not personal. Don't take it as a rejection, but this is what I do professionally. And so I'm here in a professional capacity, and I'm here for you.
So, tell me, what are the few most common ailments that you're seeing mentioned in these issues that you see today?
I would say mental health conditions or struggles are a lot around feelings of repression, feeling anxious or having anxiety, a lot of relationship dynamic issues of dysfunction in your relationships, whether it's parent-child, couples, friendship dynamics, right? And I think that this situation comes
Take friendship.
life is just.
Strange friends and all.
I mean, breakups happen everywhere, right? Could be friendships. Sometimes friends drift apart. There's loss. There's grief. All of these things. You don't need.
Few of you I'm taking. Sorry.
It's about therapy is about the human experience, and the human experience happens to everyone, and across dynamics, relationships, circumstances, etc. So people want to talk about. I think a lot of it is about feeling lonely. A lot of it is about feeling misunderstood, disconnected, not feeling seen or heard. I think it's just general people stuff, right? I used to work more with people who have more severe mental health issues, like, say, bipolar disorder or schizophrenia or addiction issues and things like that. But more, my practice now is a lot of just like regular folks. I'm not saying normal or abnormal because we don't use that terminology, or crazy, but it's just people that are struggling. And I think post-pandemic even more, and with things changing even more. But I also want to say that a lot of people use technical terminology like depression and OCD and things very loosely. Oh my God, I'm so OCD. No, you just like having an organized workspace or organized home. That doesn't make you OCD. Or sadness is not the same as depression. Nervousness and fear is not the same as anxiety. And they are, I think maybe because of social media or maybe because of more mental health care denormalized, people are using a lot of technical terms inappropriately. And so it's really important that because these are really serious things,
So I want to talk about a few. Satvik, let's talk about depression. I think you all know that there's scholars that find it now, you, and also one is people use this stuff very easy. So I don't know how to say that, asked with this, but what would you say that this is the time when these are the signs that probably you're going into depression? I mean, hey, can you help us with a little bit of those subtle signs?
Yeah. So I would say we need to stop sort of talking about the name. Don't stop saying depression or anxiety or whatever. It's about the symptoms. How is it affecting your life? Are you sleeping less or sleeping more? Are you eating less or eating way more? Are you disconnecting from your support system, friends, family? Are you losing interest in things? Is it difficult to concentrate? Are you crying? Are you doing a task that you think you have something else that happened? So it's about symptomology. And with our symptoms don't feel normal for us, that's when we know you need to ask for help. Because what's normal for you or baseline for you might not be normal or baseline for me. So you know yourself best. So if things are not feeling okay, it's not okay. And then ask for help.
Because if I ask this because for me personally, I think you're usually, why I'm a little confused and I was quite late is because I never saw that shift, that sudden shift. And I still believe it was very sudden. Does that happen?
It can.
Right?
It can happen suddenly, but generally there is a shift. But because we don't realize, because we're busy, because we don't want to see it, because we don't want to admit that maybe there's something going on and I feel a little scared or uncomfortable. But it's okay. I'll be fine. It'll be fine.
Yeah. Because what happens?
Why would I go through this? I don't have all this work.
Yeah. Right? No, yeah, because I think for me it was immediately post the second wave of COVID. And I think I get to now that, I was so busy in the setting all doctors were.
You know your health.
Right? Yeah. So, and then what happened is the second wave of COVID went and I myself got COVID. And, after everything had passed off, right, and we're all settling, and then I used to treat COVID-19 patients, and then I got COVID, and then I got dengue in 1 week later. And then suddenly something happened, and I was just out.
So here's the thing. Mental health struggles don't happen in a vacuum. It's not like everything is great and, oh my God, I'm suddenly depressed, right? There are things going on inside of us. There's things going on inside of our brain. There's environmental factors. There's relationship factors. There's work circumstances. So many things can contribute to our overall mental health. So when there's a lot going on, we don't always stop to think, oh wait, what is the impact it's having on me? Because we're so busy living life and doing things that it can be hard, I think, to take inventory sometimes. And so then it slips right past, right? Or, TK, I'm not beauty, I'm not this, I'm not that. It's okay, it's not that bad. A lot of people say, it's not even that bad. Do I really?
Until it's that bad.
Exactly. Well, that's the problem, right?
Yeah.
We don't, I would love for people to not use mental health care or mental health professionals as an intervention once it's too late. You don't have to hit rock bottom. You don't have to get so bad before you reach out for help.
What happens? I mean, as we were talking about, as a preventive aspect.
Yeah.
But when someone really comes to you with chronic depression and they're like really bad, oh, it's such a big responsibility. Like, do the therapists also get scared that, will I be able to do the right thing? Will you be able to put this person out? Are you constantly scared that what if someone takes a misstep? Does that happen?
Yeah, of course. I mean, I've had a former client divest the site, right? But I'm a bit scared. We worry about that, but here's the thing. I am not responsible for someone else's behavior, choices, actions, thoughts, beliefs, emotions, including my clients. And that might sound cold, but it's matter of fact, right? I cannot lose sleep over whether my client is going to be okay or not. I have to trust that I've done what I can. And then the rest is in their hands, right? Or it's, how do I explain it? If a client is, say, having suicidal ideations, then I will contract with them that, okay, between now and the next time I see you, you will not do anything to hurt yourself. Or if you do feel like it, you will call so-and-so, or you will go here, or we'll do that. Again, it's about empowering them to be able to take care of themselves as best as possible. It might not be great, but that's okay. Something is better than nothing. But I don't want to create a tendency where they call me up at 9 o'clock at night or 10 o'clock. Ame, I'm going through this. I can't, right? Otherwise, I would not have to battle for anything else. And I have other clients. So it's my job is to feel concerned, express comfort and support, but not be responsible. Accountability is ours, right? Something terrible could happen to me. I could have been traumatized by someone or something. That's not my fault. But figuring out how that affected me, how that impact is having an impact on what I do to others, that's on me. That's my job, right?
And coming to depression, why do you think it's increasing so much? Or you think it was always there and now we're acknowledging it?
Probably, yeah, of course. People have struggled with mental health for eons, right? We didn't have a language for it. We didn't have the words for it. We didn't have the space for it. We didn't have the resources for it. Now we do. And so other people are talking about that. It's the way that people are talking more about, say, domestic violence or rape. After Nirbhaya happened, it was like all of a sudden it was on everybody's tongue. In this culture, whether overtly, covertly, women are being assaulted left, right, and center, emotionally, physically, sexually. But it's been so normalized, and everyone has been conditioned to keep everything in. Don't talk to strangers about our family problems. Keep everything right? It will bring shame. Somehow women, like the honor of the family is on the woman's shoulder or in the woman's vagina. Somehow it's been decided that she is the representative for making everything okay. And so we do a real disservice when we tell people that their emotions are not valid or they should be grateful for right? Or you in this house and you have this, you have that. What's the big deal? Get over it, right? He's also stressed out. Blah, blah. So it's happening. It's been happening for ages and ages. But now people are talking about it. Now people understand that you don't have to accept it, that there's more options, that there's support. And I think that's what's happening. People are getting more empowered, I hope. It's the same with the LGBT community. There's so much abuse and this, but people are scared. Like right now, they're so marginalized, especially here. So the more we let people know that they're not alone and they have support, the more people are going to continue to ask for help.
I want to talk more about both of it. So about domestic violence again, as you said, and I heard one of the podcasts on it also, and I realized there's so many layers to it. I don't even realize when you said something like where you're earning your money, and still the control of the money is in the man's hand or in the in-laws of family's hand. So I wanted to discuss few of these more subtle signs that someone would be undergoing but have not acknowledged it or have not realized that something wrong is happening.
Yeah.
Yeah.
So domestic violence or intimate partner violence is basically, it's a pattern of coercive behavior where one person tries to maintain power and control over the other person. And they do it through verbal abuse, emotional abuse, mental abuse, physical abuse, sexual abuse, and financial abuse. So it's little things like when you're wearing that. I mean, I'm only looking out for you, but I would wear that if I I were you. Or you would see that friend, she's a very bad influence on you. Then people are going to start talking about you. Do you really want that? Or you put that in your ear? Why would you do that? It looks fine, right? So that's like backhanded or negative compliments. And what they serve to do is so that there can be coercive control. So people associate domestic violence or intimate partner violence with hitting, kicking, slapping, etc. But there's so much else. Like I know women that, educated professional women who work outside of the home and still have to hand over their paychecks to the mother-in-law, father-in-law, husband, or whatever, don't have any autonomy, right? It comes down to autonomy, choices. And if you don't have choice in your life, that's not healthy. If you don't have autonomy over your body when you want to have sex with your partner or want to be intimate with your partner because you're coerced, you're forced, that's violence. That's assault, right? And marital rape, though, still not passed.
So if someone comes to you with these cries, sometimes it's a little worse. If, for example, a patient comes and tells a therapist that he's been hitting me, how they do have to report it?
No, there's no laws here. I think we talk big game about, supporting women and this and that. But all I hear people say is, but so many women give false reports. I'd be like, there might be 5 women that give false reports, but 95 women are actually being assaulted, isn't it? We're so convenient and quick to blame the fake report that actually hold the 95 men or families accountable, right? So I can't report it. It's not my job to report it. I can encourage her to report it. Because again, if I say you have to do this or I'm going to call the police, then I'm also taking her autonomy away. Then how does that make me different from what she's already going through, right? And also, people who have been living in certain circumstances have developed their own survival mechanisms. They know how to get through. They know what to do, how to say it. And also, let's be honest, divorce is still a stigma here. Single motherhood is this, you can't do that to your children. What will your children do if their parents are divorced or separated? We tell women all the time that it's their job to look out for everybody else, not themselves. Think about their feelings. Think about your family, your husband, your family, in-laws, your partner, your child, whatever it is. But don't think like yourself because you're being selfish. So the messaging in our culture, in our society is, it could be worse. It's not worse, right? So suck it up, deal with it. I have a client who came to me for anxiousness and inability to sleep. So fine, take it. That's the prosthetic problem, right? But when you get down to it, she's been in a marriage for 25 years. He's abusive. She's never had voluntary sex in her marriage. It's either coerced, forced, manipulated. He controls her. He's dominating. But everyone's like, he's so wealthy and look at your house and look at your car and this and that. So she has been made to feel for 25 years that she just has to shut up and be grateful. And now she's realizing before he's like, wait, I want more than this. I deserve more than this. But she's not even been able to give herself permission to say that, right? It wasn't until she was sitting in therapy after 5 sessions, she said, yeah, this is not okay. Because she's been conditioned to believe, it's okay. It's the norm. Sabki ghar mein hota hai.
So then, what will you tell to the partner? Because,
I don't. I'll tell you, I'm sorry to cut you off. No, here's the thing. Couples therapy is not effective when there's abuse in a relationship. Because all that will happen is they're going to come and sit and talk to me. He's just going to tell me all the reasons that she's wrong and why she deserves to be hit or controlled or abused. She's not going to feel safe enough to talk because he's going to go home like, you said this in front of her and then get abused more. So there's no, couples therapy is contraindicated when there's abuse in the relationship or dynamic. Because there's no point. It's not going to stop, right? The abuse only stops when the person decides they want to stop. It's the same reason people abuse, because they can, and they get away with it. It's condoned, it's supported.
But you were giving these examples, and I was just thinking, how do you differentiate? Like, for example, you said that, "ठीक है, पहन लो, बड़ी अच्छा नहीं लग रहा." Yeah, oh, really? You're wearing this? How? Didn't meet this person? How to differentiate whether it's actually good faith? Some people might, I don't do they, and might say, would just be a normal conversation, and they just say it, and then for someone who's at the other end, like what can they take that one, that is this really happening? And is it really meant to be what was said, or is something deeper to it?
Yeah, so I think, in any communication, there's intention and impact. I can say so to you.
My intention might be good, but the impact, the way you receive it, might not be because of whatever else, right? Other factors. So, and also domestic violence is not just about, why are you wearing that? Right? It's a pattern of behavior. It's that the feeling of, well, if I don't wear what he wants me to, then anyway, I'll have to listen to, you look this. People were saying you look like stupid and blah, blah, blah. Like there's a pattern. It's not, nothing happens in a vacuum. It's not about just one isolated incident, right? It's looking at the pattern. When she hears that key turn in the door, how does she feel? Does she feel like she has to walk on eggshells? Do the kids feel like they have to make sure everything is okay before Papa comes home? Can she, when they're at a social gathering together, can she talk to someone without afterwards on the drive home? I saw you talking to him. What were you doing? You're flirting with him, so-and-so. People were talking like that. It's a pattern of behavior. We're not looking at singular incidents, unless it's overt abuse, and obviously it's abusive. But, extreme jealousy, wanting to get involved super, super quickly, feeling very possessiveness, but making it about love. Jealousy is not about love. Jealousy is about mistrust and possessiveness and insecurity. So,
you also touched, the LGBTQ community when we were talking about depression and I mean, not enough things are ever said about it.
Yeah.
And so I would want you to tell us, in fact, of course, it's a marginalized community. Yeah. There's been a lot of oppression, all of these things going on.
And still is.
Still is, correct, unfortunately.
Yeah.
And so one, of course, I think personally, I might not be a authority to say this, but I think everyone, at least, especially in this country or anywhere, if they belong to that peer spectrum, I think should go for therapy. Because there's some, do you think that?
Well, I think that there's a very common saying in the mental health world, right? That people who are in therapy because the people around them won't go for therapy. So we are going to get affected by our environment. If I am part of a marginalized community and I don't have safety or support, or my family has disowned me or is ostracizing me or sending me to some random camp so I can get straight or whatever it is, I'm going to need support, right? And I think that maybe the stigma has gotten a little better, but any marginalized population is already more vulnerable than others, right? So we must, the onus is on them, but we must be allies, right? We must declare ourselves as allies, as understanding, as supportive to anyone on the queer spectrum, because why not?
Do you get a lot of times these days?
I would say a lot, but I've definitely worked with people, that identify. Yeah, for sure. But
here, do you think it's then becoming more now in your 15 years of
experience? I think there's more resources available. I think there's more organizations that are, I think there's like in Berta, there's Bicol. Yeah. So I think there's more places, but Berta is also small, right? So it's hard. It's small, so people know each other. So there's less of a likelihood that people will reach out for resources, because if they're not out to their family or friends or work or whatever, they don't want to be accidentally outed. Of course, because there are still negative circumstances to being a part of the queer spectrum, right? So, and already it's misunderstood. And then on top of it, if you add mental health to the mix, it feels even more isolating,
So also, but you would be doing a lot of virtual counseling sessions. That is something I wanted to talk.
Yeah.
Is there a difference? Because I think most of the time, even when I was considering the first time, the few first one or two were virtual, and it kept on kind of questioning myself that is virtual actually going to work? What would you say? Is there a difference?
Of course, there's a difference, but I've not seen any major differences in effectiveness or efficacy in virtual therapy versus in-person therapy. I think it's about the connection. And so the connection can be made even through a screen, because if your universal need is to feel like you're being heard and seen and that you matter, that can happen through the screen too. It doesn't have to be sitting like this in face to face. Yeah. And a lot of my clients are pan-India or even global. So then, yeah.
So social media. Well, of course, it is a double-edged sword.
Yeah.
The great thing is, I feel definitely because of social media, People have gotten more aware about it. I think people have understood that there is something known as therapy, and when we introduced to the concept, I think only with social media to the way it has come right now. But of course, it has its pros and cons.
Right.
What is your take on it?
So I have a lot of take. How much time do you have? Well, first of all, social media is not therapy. It's information, right? The second thing is, the pro is that it has made mental health information and resources accessible. It's a boon, right? Because so many people who might not otherwise be able to reach out or get information about what is depression or what is this or what is a normal struggle are accessing it, which is fantastic. The problem is that on the one hand, people are only showing their highlight reels. And in a space and a culture where we have grown up so focused on external validation, it's dangerous. Because it feels like, oh, well, so-and-so's doing this. Oh, she's doing this. Oh, I'm only doing this. I haven't done this. So I think it contributes to insecurity, inadequacy, lack of confidence, but also accessibility. I mean, it is a double-edged sword, and I think it's going to stay that way. The problem that I have with social media is that there's this overuse of technical terms, mental health-related technical terms that have been sort of usurped by the people, like, oh, I'm so triggered. This thing happened and I'm so triggered. So I had to put up a reel about this. Like, not every negative experience is traumatic. Sometimes it's just a shitty experience. It makes you feel bad, painful, fine, but not traumatic. Not every response I have is a trigger. Oh my God, I'm so triggered. No, I'm just reacting. I'm responding. I'm having an emotion to what you said or did. And not every terrible thing or person is toxic. But these words, it drives me batty when I hear these words used all the time, because actually, trauma is really serious. And so when we normalize it in a negative way like that, it has an effect, right? Because then it's so people will come to me, I have OCD. I'm like, really? How do you know that? Oh my God, because I can't stand it if my mug is like this. I'm like, that's just like a rigidity. You're particular about things. That's not OCD, So I think that people are sort of self-diagnosing because there's so much access to information, but just talk to a professional.
Correct. And also I feel with social media, I want to get to also the holistic aspect of it. Well, of course, in Modi's Raj, we are not saying yoga and meditation don't work. We know that it works. I think you've answered the question. But now, so that's what, because we're talking about social media, I think a lot of times that happens with us in Danax also.
Yeah.
Oh, do this, and why do you need an OC pill? You have a PCOA periods and regular OC pills, you shouldn't screw it, and they're just gynecs are just going to prescribe you OC pills. Instead, go for exercises, start doing yoga, start doing meditation, and everything is as good.
Ayurvedic medicine.
Correct. I mean, with all due respect, might work, but the point is for whom? And who's giving you? Are you being diagnosed? So I think with social media, even with therapy and mental illness, I think the issue is everyone's also becoming like everyone's is a health expert today.
Yeah.
A yoga teacher claims to clean everything from depression to endometriosis to infertility to even cancers. I mean, there are this great influencers on social media who claim to cure cancers.
Yes. That's amazing.
So one, of course, is I wanted to talk about how important is holistic health approach and how overrated is it?
I think misinformation is dangerous, no matter the subject, right? And unfortunately, because everyone has access to Google, everyone thinks that they are the expert. So I'm sure you have clients come in or patients come in and say, listen, I've read this, I need this.
All the time.
Right? So in the same way that happens. So what I say is when someone comes in, the first thing I say is stop reading. Stop Googling. Stop reading self-help books, because self-help books don't help all that much. But also because holistic medicine, wellness is wellness. There's no harm. If you're going to do yoga every day, great, good for you. It's good for your body. It's not a cure for depression because there is no cure. That's the bottom line. There's no cure for mental illness. There's management, medication, therapy, techniques, lifestyle changes in terms of perspective changes, mental health, mental shifts, things like that. But yoga is not going to cure
a disease or a condition, right? Yoga will make you flexible. It might improve your sex life. It'll improve your breathing. It'll make your health great overall. Super, do it. No problem. But don't do it because you think it's going to cure anxiety, depression, schizophrenia, etc. I think there's a time and place for everything. And I'm not saying that this industry is bad or that is bad, but I'm just saying let's not overlap or misattribute. That's dangerous, you know?
You know, when we were having this conversation, you said you had a lot of experience with, of course, not only just sexual assault, but you've also worked with human trafficking programs. I don't know a little bit about it.
Yeah. In India or abroad?
In India.
Yeah. So when I was in New York, I worked with sexual trafficking survivors because there it's different. You're not having people, like some of them were brought over from other countries with the promise of good paying jobs so they could support their families back home. They came here, their documents, they came to the US, their documents were taken and they were put in domestic labor jobs or sexual trafficking, servitude type of jobs. A lot of times, runaways we already know, again, marginalized populations are more vulnerable. So if you have a child who has experienced childhood sexual abuse, they're already more vulnerable. They're looking for someone to take care of them, to treat them well. So they're more susceptible to being trafficked. Here, trafficking happens too, right? People are trafficked from one state to another for jobs, for nanny positions. They end up doing sex work. For salon work, they end up doing sex work. It's any type of poverty is the biggest, obviously, factor to vulnerability and being susceptible to trafficking, lack of family support, history of abuse, physical, sexual, big factor. So the thing is, it's about believing the survivors. That's ultimately what it is. Whether someone's experienced domestic violence, sexual assault, sex trafficking, child abuse, believe the survivor. Nobody has any reason to lie about something knowing how big a stigma it is. Why would people lie? Maybe there's a handful of people that might for attention or for resources or something. But in my experience, and I've worked with, I would say thousands of people, no one's lied. They might have exaggerated because you know what? If I say this is happening, what happens is, what's the big deal? So they may exaggerate because they're desperate for help or resources or they need something. No one hears them. But lying it's a myth.
And also about female genital mutilation. In fact, one of my friends I was all aware that 8th February is I think female genital, zero tolerance for female genital mutilation day. So
some you're talking about FGM.
So also FGM, female genital mutilation, you told me you've worked with a lot of that, and something that's, I think, really, really needs more awareness. I think a lot of people, in fact, a lot of doctors would also not know what FGM is. And, I myself recently was introduced to the fact that 6th February is like zero tolerance day for female genital mutilation. Can you explain us what is female genital mutilation?
I can give you a general, as much as I'm not a medical doctor, but it's when there is some type of cutting or surgical removal of female genitalia, whether it's outer labia, the inner labia, the clitoris, sewing up the vaginal opening, in order to control women's sexuality and pleasure. It's a practice it's done a lot in like Africa and even parts of Asia. And so I worked with a lot of African refugees and immigrants when I was in New York, and some of them have experienced this. And obviously it is a form of torture. It's involuntary. It happens oftentimes once the girl reaches menstruation point. It's considered a rite of passages in a lot of cultures, but the problem is that it's not voluntary. And it's incredibly painful, obviously. And oftentimes it's irreversible and can cause major health complications as well as reproductive health, sexual health complications. I hope that there's more awareness about it. I haven't had any clients here in India that have experienced it or survived it, but it's still happening.
No, because I bring it because, there's a very thin line, of course, and there's a difference, of course. But now, since, labioplasties, clitoroplasties, for cosmetic reasons, have also started becoming very common. I get patients very often who come and say, I think my labia is not looking right. And it's absolutely normal, but it's just more aesthetics.
Where did that come from?
That's the point. So now there's a huge layer to it. Is it coming from social media? Is it coming from the security? Is it just something that they want?
The partner saying why?
Oh, the partner is saying. So that's happened a lot of times where, the couple has come and the partner thinks that she's got to usually, you're going to enjoy, it comes on the way. Or whatever, like X, Y, Z.
Sorry.
No, he tried to explain a lot of.
Yeah, that it's
normal.
Everyone's body.
Everyone's body.
Everyone's body.
But then how do we differentiate between something? And at the same time, we want women to be, empowered. We want them to have the autonomy.
Yes.
And, because I remember one of the clients said that, why are you so resistant against doing it? And of course, then you do something on the labia, there are a lot more faults. And she said, tomorrow I go for a filler or I go for like a boob job. I think, no, like, that's not the question, but, why do we... So because, as you said, when you do something in the reproductive area, you don't know the pain. Is it actually going to do your sex, or it's on long term? If not done right, it might even lead to a lot of complications. So, but that's the technical part of it. But I think the greater question that I want to address with you is that how do we differentiate between body insecurity, what dysmorphia is a huge word, body dysmorphia, and autonomy and that independence of what you want to change in your body to make you feel more confident.
Yeah, so I think that that's a really good question. I think that there's a lot of factors that are involved here. One is one that we don't talk about a lot, which is porn consumption and the effect of porn consumption on the idea of what bodies look like, the idea of what women's pleasure is, what men's pleasure is, body dysmorphia, expectations and intimacy in sex, everything. I think a lot of it is part of the consumption of pornography. So I think having comprehensive sex education would help, right? To understand that everyone's body is different. Everyone's reproductive areas look different. And it's hard to determine what is the factor that is perhaps raising this query about, I need this done or I need that done. And I think that sometimes you'd know, right? You would know as a professional if there's something happening with the general reproductive area that might be inhibiting or causing pain during sexual intercourse or during sex in general. But I think asking the person, how did you get this idea? Was it your partner's idea? Is it your idea? That, everyone's body is different. And so some ladies are short, some are long, some are droopy, some are firm, blah, blah, blah. And just normalizing it and getting them to understand that this is not about aesthetic. Like pleasure is pleasure. It's not supposed to be about what your body looks like.
Correct.
Right?
Correct. So, because most of the time they don't know the actual, ways and techniques of orgasm rather than they keep on changing.
So when I see a person struggling with that, what I say is, do you know what your own body looks like? Hold a mirror, go squat, hold a mirror and get to know your body first. Get to know what feels good to your body. Get to know what you need for orgasm. It's not just about your partner's pleasure. It's about your pleasure, right? And so getting more comfortable also is going to lead to more acceptance of self.
We've been talking about mental health, and men's mental health is hopefully coming up in a huge way, because I think do you think men are more resistant to approaching for mental health issues?
Of course. I think a lot of times, they're resistant to acknowledging mental health struggles because they've sort of been conditioned not to talk about it, right? Men are not given the same tools, or at least haven't been given the same tools or even the same permission to say, I'm not feeling good about myself, or I'm having a hard day, or I'm feeling lonely, or I'm feeling scared or sad or overwhelmed. We as a culture don't talk about mental health. So obviously men are even a step removed from that, because there's also this expectation of what it means to be a man. And what it means to be a man in this box that our society has created is be strong, be firm, be aggressive, earn money. No, don't be weak. Don't express emotion. Be a tough guy.
Correct.
Right? And I think that we do ourselves a disservice when we put anyone in a box. And what we need to remember is that we're all human beings at the end of the day, and that our mental health, my money or my gender is not an obstacle for a mental health struggle, right? As I said before, it affects everybody. And I think that the more we normalize it, the more we say, I hear you, I see you. And here's a space that you can go where you won't feel as alone.
Is the approach different
No. The approach is not the approach is different in that sometimes it's just different obstacles to break down.
Oh.
For a client who identifies as female, it might be a different set of obstacles that she's facing. And for someone who identifies as male, there might be different obstacles, right? So it's about understanding the person, whoever that person is, regardless of gender, and what is the struggle. Some men do come. I've had a lot of male clients here. In New York, I was working exclusively with women, generally because that was the population. Survivors and victims are predominantly women. Here, because it's more general mental health, I have clients who identify as male as well. But the struggle is similar. I do see more addiction issues in men as a way to suppress those emotions and suppress that not knowing where to put all that feeling. So I just keep it in and I'm going to drink or I'm going to do drugs or whatever it is to cope.
Do you have men who come with sexual abuse?
Oh, yeah.
Victims of sexual abuse?
Yeah. Survivors.
Survivors.
Yeah.
Correct.
Yeah, of course.
So one thing that I've always, when it comes to self-care, kind of not struggle, but wanted to understand more is the issues with boundaries, I've heard a lot of mental health experts talk about boundaries. And how do you set a boundary, first of all? I think we've been grown up in a society where one saying no is so difficult sometimes.
Yeah.
But then at the same time, I don't want to be rude.
Yeah.
I don't want to be a people pleaser. I mean, I want to be a people pleaser, but I don't want to be a people pleaser. So what is the definition of a boundary, and where do you set it, and how do you balance it between being someone who's rude or someone who's not helpful, and to an other extreme where you are like a people pleaser to a negative impact, for yourself?
Yeah. So those are extremes, right?
Correct.
You want to find a middle ground.
Correct.
So I think a boundary is simply a statement that tells the other person what I am okay with. Right? So if we're having a conversation and you start using abuses or things like that, the boundary I set is, if you're going to speak like that to me, I no longer want to be a part of the conversation. I'm not saying you can't talk like that, but I'm saying I will not involve myself in this conversation if you're going to talk like that. Right? Now, here's the thing. We think culturally boundaries are terrible. How can you set a boundary? How can you say no? Because we've been conditioned to always be there. To always make ourselves available, be there if someone needs it, never say no, because that's rude and selfish. But every time you say yes to someone, you are saying no to yourself in some way. And that's not okay. We overextend ourselves. We're not doing anyone a service. We're not helping that person or hurt ourselves. If I don't have the bandwidth to, if I'm seeing 5 or 6 clients a day and someone's like, I need to see you today. If I say, I'm sorry, that's not possible. My next available appointment is 2 days from now. I'm not being rude. That's not a rejection. I'm simply saying, this is all I can do. I want to help you, but here's when I can help you. Right? So it's not about being rude. It's actually about being kind to yourself. And you don't have to set a boundary in a rude way. You don't have to say, listen, you jerk. I said no. Right? You can say, that's not going to work for me. Thanks for thinking of me, but that's not going to work for me. Right? Or I can't manage that right now.
Correct.
But let me see if I can help you find someone who can.
So talking about boundaries, I'm going to cross one. So we're going to play a game called a truth serum test. So, I mean, in psychiatry, we have this thing called truth serum. If prisoners or so-called, people who've been caught for some XYZ things are given this injection, which is, I think it's called sodium thiopenton, so that their inhibitions are lost and they speak out the truth.
Okay.
So we have a set of 12, 13 injections here. Okay. We're not going to inject you, but you have to pick. So we're going to ask you 5 questions. Then they are numbered, so and I have a cue card. Okay. Whichever number you pick up, I'm going to ask you that question, and if you answer that honestly, yes, as simple as that.
All right.
Let's begin.
Okay. I'm going to go for this one.
The number is 3.
3. Okay.
So this is interesting.
Oh.
So have you had a client who's come back asking for fees later, saying, after completing session, saying that it's not worked?
Of course. Yeah, of course. You can't please everyone.
Correct.
Right? So yeah, people come back like,
give my money back?
They won't say give my money back, but they'll not pay.
They'll not pay.
Oh, I have to
go upfront nahi lente, huh?
I do generally, but something like, I didn't bring my wallet. It's okay, been given it. And then you have to go chasing them down.
That's the problem with our medicine, na? Sorry. Another one.
Or I just need to set better boundaries.
You need to set better boundaries. Pay and then enter. And then you people will call you rude now. So see, how do you set boundaries?
I'm okay with I'm not here to be liked. I'm just here to do my job.
Right.
All right. Shall I pick another one?
Yeah.
Okay. How about this one?
8.
Okay.
I'm going to ask you the 7. Sorry.
All right. That's okay.
Has a client ever made a pass on you?
No.
No? Come on.
No.
No? All right. Another one. 3rd.
That was an easy one.
That is 6. This is a nice one. Like, do you have that one client which kind of made a huge impact on you? Can you tell something about?
I do have one client that I still sort of think about to this day once in a while. And like, I wonder if she's okay. She was a client that she just had a terrible, terrible life experience, a lot of abuse, and then just one sort of abusive experience after another. And it was a real struggle for me as a professional because I could see what she could be, but because she had been just flattened so often and over and over and over again, she just couldn't see it, and then she ended up disengaging from therapy. And but sometimes those clients stay with you.
But you said you wonder, are you not allowed to like follow up?
I mean, it's been more than 10 years now. I think for the first couple of years, some colleagues would like message, she came back or she left this or whatever. But no, I don't.
One more.
Okay. All right. Number 10.
What is your, personal go-to technique, mantra, or whatever code that keeps you motivated in your practice, which is quite tough as we've all realized now?
I don't think I have a particular mantra or technique, but what I believe truly is that people have the capacity for change, whether it's to change their mindset, their behaviors, their actions, their perspectives. This whole profession is rooted in this idea that we as human beings can change. And I believe that if we can acknowledge that we can change, then growth is possible. Anything is possible. And I think that's what really keeps me doing the work, because I feel honored to be a part of people's change.
Last.
Okay.
I was hoping you'd take this. This is the last one here also.
Okay.
So have you ever, gone out of the way, unconventionally, gone off your boundaries to do something for a client?
No, not that I can remember. No.
All right.
Out of my, no, because it's been within the scope of my work. Like when I was in my previous life in New York, there were probably after work, I would follow up on client, or we would have to escort them somewhere. So that I would do for safety purposes, because I was working with clients that were in very dangerous situations. So there was a lethality issue, or, we would have to have, bulletproof glass because if someone had a gun or something like that. So you would sort of do a little more or go after, for that, but not beyond that.
So that's the game.
Yeah, that was fun. It was fun.
So before we end, a few things. Can you tell us some, few, I won't say a number, maybe 4 or 5 self-care rituals that you as a therapist kind of think everyone should do?
Okay. First, I thought you were going to say that I do it. And the thing is, like doctors...
You've set a boundary and I'm expecting it.
Like doctors, therapists are often good at talking the talk, but not always walking the walk.
Tell me about it.
Yeah. So I would say one is find your people. Find your tribe. Know versus who is just an acquaintance or someone you know. We often confuse them. So know who your support system is. Know what your tribe is. 2 is use that tribe. Ask for help. Do things that are joyful. Not just when you have a problem, but do things that are joyful with those people. Create memories. Do things that are fun. 3 is that 2 or 3? I don't remember. 3 is acknowledge when things are not okay, but trust that they will be.
we all go through ups and downs. We all go through bad pockets, myself included, obviously, right? We're human beings. But also not trust as in be toxically positive, like, oh my God, everything is amazing. Not like that, but trust that we are meant to ebb and flow. Our emotions are meant to ebb and flow. Our experiences are meant to ebb and flow. Our life is meant to ebb and flow. And that when it feels like it's like this, eventually it will go back up. So trust that, right? 4 is don't listen to people to whom you would not go to in the first place. Everyone has an experience. Everyone has a judgment. Everyone has opinions. And people feel very free in sharing them. But try to remember that those things are just words. They're not facts. And trust the people you trust. Don't be a sponge and absorb everything from everyone.
Right.
Yeah.
What do you think about journaling? Is it really that? I mean, there's a huge debate, not a debate, discussion regarding how helpful it is, but coming from the horse's mouth.
Yeah. I've been called worse, don't worry. Journaling, I think it can be helpful. Of course, the idea, it's not about the journal and the writing and what you write. The idea is, as we go throughout our days, we experience things, we go through things, we feel things, we worry about things, we wonder about things. And at the end, everything just ends up like a big pile. And then people have difficulty sleeping or resting or letting go of thoughts and things like that. So whether it's journaling, writing by hand, whether it's leaving voice memos for yourself, I think it is important that we do some type of download, right? Whether it's talking it out with a partner or a friend or anonymously or whatever. The idea is to clear it from your head so it takes up less space and therefore impairs you less in a negative way. So journaling is definitely helpful because, of course, if I'm thinking something and feeling it, and if I write it down, it's going to take up less weight in my mind, right? I recommend verbal downloads. Open up your voice memo and just talk. Today this happened, and then I felt like this, and oh my God, this person did this, and what's going to happen with this? Just get it out. You don't have to listen to it again. Delete it. But at least it's out.
Correct.
That's the whole point.
Correct. There is, like, is there a case or is there a client where you think is like you still have an impact in terms of you think that this is one of my biggest achievements as healing them or probably helping them out?
I think there's probably
Few.
Yeah, many. And I don't say that as a pat on my back, but
can.
As a therapist, we have the privilege of bearing witness to people's experiences and people's healing, and not like in a woo-woo way, but just it's really hard to talk about things. It's really hard to talk about painful things and traumatic things. And when I get to sit across from someone and listen to those experiences and play even some minor role in them getting to a better space or feeling more confident about themselves or getting out of that abusive relationship or being able to feel more empowered, that's amazing, right? So I think my job is not to give. My job is to teach. And in teaching, people will do.
With any
And
case that I remember? And an example.
That I remember. It's hard to give examples, but I mean, I've seen people at their most vulnerable, at their hardest point in their lives, the most painful point in their lives. And a lot of them are thriving now. They've gone from surviving to just living and then thriving. And that's amazing.
Correct.
You know, even to be able to play a small role in that, that's incredible. It's a gift.
Amazing.
Yeah.
Now, I was not going to ask you, but you reminded me when I said about the self-care rituals. So you said you were going I was supposed to ask you what you do, but I rather asked you what people should do. What do you do? I think that's interesting. I mean, you are such a, as you said, you know, you download like so many people throughout the day, and they're just, venting is the wrong word, but expressing and letting you know of their difficulties. Surely has an impact on you.
You know, after more than 20 years, it doesn't actually, right? I'm able to leave work at work. I'm able to separate what I do during my work hours. I am a therapist versus who I am, right? And so when I go home, it's about who I am as a person, not what I do as a therapist. So I am able to. I probably don't do as much for my self-care as I should, to be very honest, because, you have work and then you have life and life gets in the way. And then I was going to go for that walk, or, I was going to, I paint sometimes. I go for walks. I listen to podcasts. I listen to music. I hang out with my family and my friends. Yeah. I think moving your body, stimulating your mind, doing something creative, I think all of those things are really, really important.
There was one question that it always intrigued me when I was thinking about preparing, so to speak, about talking to you. And I was trying to avoid it, but I want to ask it now. Because, us as doctors and you as a medical health professional associated with people's life, and you more so not only just life in terms of the heartbeat and everything, but it's the brain themselves and the mental health and everything. Whatever said and done, like, you've been in the field for 25 years. I might have been for 15 years, more than oddly. And if I count my MBBS days, almost 20, 25 years myself.
Yeah.
If I lose a baby, if I lose a mother,
Yeah.
I won't say that it doesn't impact me.
Of course. It's heartbreaking.
It does. And sometimes it takes days.
Yeah.
What happens when probably you lose a patient to depression, to a mental health issue? And first of all, like, what do you tell yourself?
Well, I've lost a client to suicide here. And even in my former life, I've lost clients to someone else's hands, or their own hands. What do I tell myself? I tell myself that I did the best I could with whatever I could do. I acknowledge that I have limitations. I'm not God or some all-knowing expert that I can control everything. I also know that I am responsible for what I do and what I say to the best of my ability. But ultimately, things are going to happen that are out of my control. And I feel sad about it. I feel heartbroken about it. I feel mad about it sometimes. But I also can accept that it happened, right? Like, to not just hold on to it. But again, maybe that's because it's in my personal life, right? My professional life. It was in my personal life. It's different. So yeah, but I do trust myself enough to know that I've done what I can.
What you could.
Yeah. And I have to, right? Otherwise I wouldn't be able to keep working.
If you had to say something to Ame Patel beginning in her career 20 years back, today, if today's Ame Patel had to give some advice to that Ame Patel, what would it be?
As a professional, when I was starting out?
And personal.
I would have said then that do what you can, but you can't do it all. Right? Because I think in the beginning we're trying so hard to figure it out and prove ourselves, and what you want to help everyone. And so probably I would have said that. I would have said it gets better, which is what we all should say. Probably would have said you're enough. Right? Because we're always thinking that we need to improve. And growth happens while we're living life.
Enough.
So.
Last wish.
Yeah.
So, because it's a medical podcast, I would want you to tell something and give an advice to people who are thinking of taking psychology, think of maybe turning this into a career, being a therapist, counselor. What would you want to tell those young individuals who are thinking of doing this?
Oh, that's a really good question. What I would say is, don't confuse being a good friend with being a good therapist. A lot of people come into the profession because they're like, I'm the one that my friends come to for advice, and they really like my advice, so I'm going to be a therapist, because those are two very different things, as we've discussed before. Also, before you decide to become a therapist, get some therapy, because a lot of people enter the field because actually they want to do for others what they wish people had done for them, or what they couldn't do for themselves. And so they enter the field thinking, well, I'm going to help people. I never got the help, or I never had the support, but I'm going to do that. But what I would say is get therapy first. Process all that stuff. Because invariably, if you don't, it's going to come out in your work. And also, we need good therapists in this world. So yes. And get good training.
Correct. So to end,
yes,
I would want you to kind of, end with a few sentences about Ame Patel, the profession, and the person,
Okay.
and a few lines about your life, your past, present, and your future. Whatever you want to say.
Oh, that is
The mantra you live with, you want to live with, whatever, where you've come from and where you want to reach, whatever.
I think I don't have a mantra per se, but I think what I would say is Ame Patel is a person, a woman who is passionate about her work and really believes in people and believes in the good of people and believes in the hope that people can do things for themselves. I'm a mom, I'm a partner, I'm a person, I'm a friend, I'm a daughter. And I really take all of these roles seriously. They're important. And when I'm at work, I'm 100% at work. And then when I'm not, it's about me time. And I would say that I wish for everyone healthy relationships, healthy boundaries, and healthy love and self-acceptance. I think that's what we need.
Ame. Thank you so much, Ame Patel, for coming and having this chat with us. It's been really a great talk. And I've had amazing fun, of course, enlightening, everything. So that concludes our one more episode of Second Opinion with Dr. UV, Stories Beyond Stethoscope. I'll see you again soon with another compelling stories about medicine, people around medicine, lives, struggles, triumphs, losses. And until then, as we've discussed, make sure to prioritize your self-care and compassion. Have a good day.